is Dr. Pim van Lommel. Dr. van Lommel worked as a cardiologist for more than 25 years in Hospital Rijnstad, an 800-bed teaching hospital in Arnhem, the Netherlands, and is now involved in full-time research on the mind-brain relation. He has published more than 20 articles on cardiology and consciousness, and more recently, a number of articles, a book, and contributed to several chapters about near-death experiences in survivors of cardiac arrest. His presentation will be followed by a short Q&A session. Please welcome Dr. Pim van Lommel.
Okay. Thank you very much. Ladies and gentlemen, I'm very pleased that I get the opportunity here today to discuss my concept of non-local consciousness, based on scientific research on near-death experience in survivors of cardiac arrest. A near-death experience, or NDE, or an experience of enhanced consciousness during a period of apparent coma, still give rise to many unbelieving and critical questions, especially by physicians and neuroscientists. But as already 1 century ago, William James has said, to study the abnormal is the best way of understanding the normal. How can it scientifically be explained that people can have clear memories from a period of obvious unconsciousness? Or how is it possible that permanent life changes occur after cardiac arrest of only a few minutes? An NDE is an unforgettable confrontation with unlimited dimensions of our consciousness. As long as one not has experienced an NDE himself, it seems impossible to really understand the impact and the life-changing after effects of this overwhelming experience. The existing worldview has radically changed. Quote, "It felt as if I had become another person, but with the same identity." And another quote, "You can be physically dead, but your mind lives on. Only one thing matters, your attitude toward other people. I accept life now as it is, and I'm no longer afraid of death." I will not only talk about changes in consciousness during and after an NDE, but above all I want to discuss my ideas about the relationship between consciousness and the brain. Important questions for me were, how is consciousness related to the integrity of brain function? And is it possible to gain insight in this relationship? And is there a biological basis of consciousness anyway? We can distinguish between both temporary and timeless aspects of our consciousness. This prompts the following question. Is it possible to speak of a beginning of our consciousness, and will our consciousness ever end? I realize that my approach will be new or unexpected for most neuroscientists, and that my conclusions will not always be in conformity with the currently widely accepted materialistic paradigm of Western science. I also realize that many aspects of consciousness are still a great mystery. How started my interest in near-death experiences? In 1969, during my rotating internship, a patient was successfully resuscitated in the cardiac care unit by electrical defibrillation. In those days, this was all new and exciting for us. We mostly do not realize anymore that until 1967, less than 50 years ago, all patients with cardiac arrest died because modern resuscitation techniques like defibrillation and chest compression were not yet available. But this patient regained consciousness after a period of unconsciousness of about 4 minutes. And we, as a resuscitation team, were of course very happy. But the patient seemed to be very, very disappointed. He told me about going through a tunnel, seeing a light and also beautiful colors, and hearing music. I've never forgotten this event, but I did not do anything with it. And in that time, I did not know that in human history, the same experience have been told in many cultures, in many religions, and in all times, as shown in this painting from 1480 by the Dutch painter Hieronymus Bos, showing deceased people escorted through a tunnel to the light. Only years later, in 1975, Raymond Moody first described his so-called near-death experiences. And only in 1986, I read about these experiences in a book by George Ritchie entitled Return from Tomorrow, which relates what he experienced during a period of clinical death of 9 minutes duration in 1943 during his medical study. After reading this book, I started to interview my patients who had survived a cardiac arrest. And to my great surprise, within 2 years, 12 patients out of 50 survivors of cardiac arrest in the past told me about their NDE. For me, it all started with scientific curiosity, because according to our current medical concepts, it is not possible to experience consciousness during a cardiac arrest when circulation and breathing have ceased. I grew up in an academic environment in which I had been taught that it was obvious that consciousness was the product of a functioning brain. And up until that point, I had always accepted this as indisputably true. But now, the phenomenon of near-death experiences raised a number of fundamental questions. How and why does an NDE occur? And how does the content of an NDE come about? Why does a person's life change so radically after an NDE? I was unable to accept most of the answers to these questions because they seemed incomplete, incorrect, or unfounded. But first, what is a near-death experience? Some people who have survived a life-threatening crisis report an extraordinary conscious experience. An NDE can be defined as the reported memory of a range of impressions during a special state of consciousness, including a number of universal elements, such as an out-of-body experience, pleasant feelings, seeing a tunnel, a light, deceased relatives, a life review, or the conscious return into the body. And many circumstances are described during which NDEs are reported, such as cardiac arrest, clinical death, shock after loss of blood, complicated childbirth, coma following traumatic brain injury or stroke, near drowning, children, or asphyxia, but also in serious diseases not immediately life-threatening, during depression, isolation, or meditation, or without any obvious reason. And similar experiences to near-death ones can occur during the terminal phase of illness and are called deathbed visions or end-of-life experiences. So apparently you don't always need a non-functioning brain to report a near-death experience. And the NDE is transformational, always causing enhanced intuitive sensitivity, profound changes in life insight, and a loss of the fear of death. This is why these kind of experiences are also called spiritual transformative experiences, or STE. And near-death experiences occur with increasing frequency because of the improved survival rates resulting from modern techniques of resuscitation and from better treatment for patients with cerebral trauma. The content of an NDE and the effects on patients seem similar worldwide across all cultures and all times. However, the subjective nature and the absence of a frame of reference for this experience lead to individual, cultural and religious factors determining the vocabulary used to describe and interpret the experience. children and adults, Christians and atheists, Muslims and Buddhists, they all use different words from their own religion, culture, and tradition. And NDE is an ineffable experience. According to a recent at random poll in Germany and the USA, about 4% of the total population in the Western world should have experienced an NDE. So more than 10 million people in the USA and about 20 million people in Europe must have had a near-death experience. Now, why do we physicians hardly ever hear a patient tell about his NDE? Patients are so reluctant to share their experience with others by all the negative responses they get. Patients must feel that you trust them, that you can listen without any prejudice or any comment. But for most physicians, the NDE is still an incomprehensible and unknown phenomenon. Once a conference was held about NDE in a university hospital with more than 300 persons in attendance. And at the end of the conference, after several lectures about NDE, a man stood up and said, "I am a cardiologist for more than 25 years. I have never heard such absurd stories. This is total nonsense. I don't believe one word of it." And then another man got up in the audience and said, "I'm one of your patients. I have had an NDE during cardiac arrest, and you would be the last one I would ever tell." They feel and know that this kind of doctors are not able to listen. Until recently, there was no prospective and scientifically designed study to explain the cause and content of an NDE. All studies had been retrospective and very selective in respect to patients. And based on this incomplete retrospective study, some believed that the experience could be caused by physiological changes in the brain as a result of lack of oxygen, cerebral anoxia. Other theories encompass a psychological reaction to approaching death, hallucinations, dreams, side effect of drugs, or just false memories. So in 1988, we started a prospective study in 344 consecutive survivors of cardiac arrest in 10 Dutch hospitals with the aim to investigate the frequency, the cause and content of an NDE. And this cartoon was published in the Dutch national newspaper when our study was published in The Lancet in December 2001. We wanted to know if there could be a physiological, pharmacological, psychological or demographic explanation why people experience enhanced consciousness during a period of cardiac arrest. And we did a short standardized interview with sufficiently recovered patients within a few days of resuscitation and asked whether they could remember the period of unconsciousness and what they recalled. And additionally, we performed a longitudinal study. We studied patients who survived cardiac arrest because this is a well-described, life-threatening medical situation, which is also called clinical death. The definition of clinical death was used for the period of unconsciousness caused by lack of oxygen or anoxia of the brain, due to the arrest of circulation and breathing that happens during cardiac arrest in patients with an acute myocardial infarction. And these patients will ultimately die from irreversible damage to the brain if cardiopulmonary resuscitation, CPR, is not initiated within 5 to 10 minutes. It is the closest model of the process of dying. And in cases where memories were reported, we coded experiences according to a weighted core experience index. And in this system, the depth of the NDE was measured according to the reported elements of the content of an NDE. The more elements were reported, the deeper the experience was and the higher the resultant score was. We found that 282 patients, 82%, had no recollection of the period of cardiac arrest, of the period of unconsciousness. However, 62 patients, 18%, reported some recollection of the time of clinical death. And of these patients, 41 patients, 12%, had a core experience with a score of 6 or higher, and 6% had a superficial NDE. Now, which elements were reported? In our study, about 50% of the patients with an NDE reported awareness of being dead or had positive emotions. About 25% of the patients had an out-of-body experience. 30% reported moving through a tunnel. About 25% had communication with the light or observed colors. About 30% of the patients had an observation of a celestial landscape or had a meeting with deceased relatives. 13% experienced a live review and 8% experienced a border. So in our study, all well-known elements were reported, except a frightening NDE, but I personally know patients who had a frightening NDE. Now, what might distinguish the small percentage of patients who report an NDE from those who do not? We found to our surprise that neither the duration of cardiac arrest, 2 minutes or 8 minutes, nor the duration of unconsciousness, 5 minutes or 3 weeks in coma, nor the need for intubation in complicated CPR, nor induced cardiac arrest in electrophysiological stimulation, EPS, in the cath lab, had any influence on the frequency of NDE. NS is not significant. The degree or gravity of the lack of oxygen in the brain, the anoxia, appeared to be irrelevant. So a physiological explanation for NDE, like anoxia, could be excluded in our study. Neither could we find any relationship between the frequency of NDE and administered drugs, fear of death before the arrest, nor foreknowledge of NDE, gender, religion, Christian or atheist didn't matter at all, or education. And we additionally performed a longitudinal study with taped interviews 2 and 8 years following the cardiac arrest of all late survivors with NDE, along with a matched control group of patients of survivors of cardiac arrest who did not report an NDE. And the study was designed to assess whether the loss of the fear of death, the transformation in attitude toward life, and the enhanced intuitive sensitivity is the result of having an NDE or just the result of the cardiac arrest itself. This had never been studied before in a prospective design. The NDE turned out to be the life-changing experience because only patients with an NDE did show this aforementioned typical transformation. In particular, they were less afraid of death and had a stronger belief in an afterlife. We saw in them a greater interest in spirituality and questions about the purpose of life, as well as a greater acceptance of and love for oneself and others. The conversation we had in our longitudinal study also revealed that people, often to their own amazement and confusion, had acquired enhanced intuitive feelings after an NDE. Or, as many of them put it, they had acquired paranormal gifts. This enhanced intuition is based on interconnectedness with the non-local consciousness of others and is independent of time, an inner knowing of future events or having prognostic dreams, and is independent of distance, the sense of knowing about an incoming phone call, or of pain, illness, or upcoming death of people, which usually proves to be accurate. This sudden occurrence of this enhanced intuition can be quite problematic, as people suddenly have the very acute sense of others, which can be extremely intimidating. As someone told me, I couldn't even talk about it, or I would have been committed to an institution. And I know patients who have been put in an institution because they kept on talking about it. Finally, it is quite remarkable and a surprising and unexpected finding to see a cardiac arrest lasting a few minutes give rise to such a lifelong process of transformation. However, the integration and acceptance of an NDE is a process that may take many years because of the far-reaching impact on people's pre-NDE understanding of life and value system. Despite the mostly positive experience, the NDE is also a traumatic event because there is hardly any acceptance by doctors, nurses, family, and partner, with a more than 70% divorce rate, which makes the process of acceptance and integration very difficult. And this process will take many, many years with strong feelings of depression, homesickness, and loneliness. But the longer the interval between NDE and the interview, the more positive changes are usually reported. But it may take 20, 30, or 40 years. Several theories have been proposed to explain an NDE. However, in our first prospective study ever, it could not be shown that psychological, pharmacological, or physiological factors caused these experiences during cardiac arrest. With a purely physiological explanation such as lack of oxygen in the brain, most patients who had been clinical dead should report an NDE because all patients in our study had been unconscious because of lack of oxygen in the brain resulting from their cardiac arrest. However, only 18% reported an NDE. Why? And why only 18% report an NDE after cardiac arrest is still a big mystery. Besides, it is a well-established fact that people without any lack of oxygen in the brain, like in depression or meditation, can also experience an enhanced consciousness. Another theory holds that an NDE might be a changing state of consciousness, or the theory of continuity, in which memories, identity, and cognition with emotion function independently from the unconscious body and retain the possibility of extrasensory perception. Obviously, during NDE, enhanced consciousness is experienced independently from the normal body-linked waking consciousness. In 4 prospective studies with identical study design, our Dutch study, the only study with statistical analysis, 1 study from the USA, from Bruce Grayson, and 2 studies from the UK, from Sampani Peter Fennick and from Penny Sartori, about the same percentage of NDE was found in a total of 562 patients who survived cardiac arrest. And all authors conclude that no one physiological or psychological model by itself could explain all the common features of an NDE. Bruce Grayson writes in his comment that the paradoxical occurrence of heightened lucid awareness and logical thought processes during a period of impaired cerebral perfusion raises particular perplexing questions about our current understanding of consciousness and its relation to brain function. A clear sensorium and complex perceptual processes during a period of apparent clinical death challenge the concept that consciousness is localized exclusively in the brain. As Sampani and Peter Fennick write that the data from several NDE studies suggest that the NDE arises during unconsciousness. This is a surprising conclusion because when the brain is so dysfunctional that the patient is deeply comatose, those cerebral structures which underpin subjective experience and memory must be severely impaired. Complex experiences, such as are reported NDE, should not arise or be retained in memory. Such patients would be expected to have no subjective experience at all. And Penny Sartori concludes that according to mainstream science, it is quite impossible to find a scientific explanation for the NDE as long as we believe that consciousness is only a side effect of a functioning brain. The fact that people report lucid experiences in their consciousness when brain activity has ceased is, in her view, difficult to reconcile with current medical opinion. With lack of evidence for any other theories for NDE, the concept thus far assumed, but never scientifically proven, that consciousness and memories are produced by large groups of neurons and are localized in the brain should be discussed. How could a clear consciousness outside one's body be experienced at the moment that the brain no longer functions during a period of clinical death, even with a flatline EEG? And furthermore, even blind people have described veridical perceptions during out-of-body experiences at the time of the NDE. Scientific study of NDE pushes us to the limits of our medical and neurophysiological ideas about the range of human consciousness and the mind-brain relation. Before I discuss in greater detail some neurophysiological aspects of normal brain function and during cardiac arrest, I would like to reconsider certain elements of the NDE, and first the out-of-body experience. In this experience, people have veridical perceptions from a position outside and above their lifeless body. NDEs have the feeling that they have apparently taken off their body like an old coat, and to the surprise, they appear to have retained their own identity with the possibility of perception, emotions, and a very clear consciousness. This out-of-body experience is scientifically important because doctors, nurses, and relatives can verify the reported perceptions. And they can also corroborate the precise moment the NDE with OBE occurred during the period of CPR. In a recent review of about 100 corroborated reports of potentially verifiable out-of-body perceptions during NDE, Jan Holden has found that about 90% were completely accurate. 8% contained some minor error, and only 2% was completely erroneous. This proves that an OBE cannot be an hallucination, because this means experience and perception that has no basis in reality, like in psychosis. Neither it can be a delusion, which is an incorrect assessment of a correct perception, nor is it an illusion, which means a misapprehensive or misleading image. A real OBE is clearly shown in this drawing of a 6-year-old girl who nearly drowned and was resuscitated in the hospital. In this drawing, you see a happy and smiling girl watching her resuscitation from above. You can see it here. With many correct details, like chest compression by 2 nurses. A 6-year-old girl doesn't know anything about CPR, but she saw it. And this is the report of a nurse of a coronary care unit. During night shift, an ambulance brings in a 44-year-old cyanotic, this is blue, comatose man into the coronary care unit. He was found in coma about 30 minutes before in a meadow. When we go to intubate the patient, he turns out to have dentures in his mouth. I removed his upper dentures and put them onto the crash cart. Only after about an hour and a half, the patient has sufficient heart rhythm and blood pressure, but he is still ventilated and intubated, and he is still comatose. He's transferred to the intensive care unit to continue the necessary artificial respiration for 1 week. And after more than 1 week in coma, do I meet again with the patient who is by now back on the cardiac ward. The moment he sees me, he said, "Oh yes, you know where my dentures are." I'm very, very surprised. And then the patient elucidates, "Yes, you were there when I was brought into hospital, and you took my dentures out of my mouth and put them onto that cart. It had all these bottles on it, and there was this sliding drawer underneath, and there you put my teeth." I was especially amazed because I remember this happening while the man was in deep coma and in the process of CPR. It appeared that the man had seen himself lying in bed, that he had perceived from above how nurses and doctors had been busy with his CPR. He was also able to describe correctly and in detail the small room in which he had been resuscitated, where he was admitted in coma and had left in coma, as well as the appearances of those present, like myself. And then the holographic live review. During this live review, the subject feels the presence and renewed experience, not only of every act, but also of every thought from one's past life. And one realizes that all of it is an energy field which influences oneself as well as others. All that had been done and thought seems to be significant and stored. Because one is connected with the memories, emotions, and consciousness of others, you experience the consequences of your own thoughts, words, and actions to that other person at the very moment in the past that they occurred. Interconnectedness. Patients survey their whole life in one glance. Time and space do not seem to exist during such an experience, non-locality. Quote, all of my life up till the present seemed to be placed before me in a kind of panoramic, three-dimensional review, and each event seemed to be accompanied by a consciousness of good or evil, or with an insight into cause and effect. Not only did I perceive everything from my own viewpoint, but I also knew the thoughts of everyone involved in the event, as if I had their thoughts within me. This meant that I perceived not only what I had done or thought, but even in what way it had influenced others, as if I saw things with all-seeing eyes. And so even your thoughts are apparently not wiped out. I always say, consider the impact of this statement for a moment. Your thoughts are never wiped out. And all the time during the review, the importance of love was emphasized. Looking back, I cannot say how long this live review and live insight lasted. It may have been long, for every subject came up, but at the same time it seemed just a fraction of a second, because I perceived it all at the same moment. Time and distance seemed not to exist. I was in all places at the same time, and sometimes my attention was drawn to something, and then I would be present there. And also a preview or a flash forward can be experienced. People feel like they can see a part of the life that is yet to come. And again it seems as if time and space do not exist during this preview, non-locality. Quote, and then in a flash I saw the rest of my life. I could see a large part of my future life, taking care of my children, my wife's illness, everything that would happen to me, both in and out of the workplace. I could see it all. I foresaw my wife's death and my mother's passing. One day I wrote down all the things I saw back then, and over the years I have been able to tick them all off. For instance, I saw my wife on her deathbed, wrapped in a white shawl, just like the one she was given by a friend of hers some days before she died. And it is also possible to come in contact with the consciousness of deceased persons, interconnectedness. Quote, during my cardiac arrest, I had an extensive experience, and later I saw, apart from my deceased grandmother, a man who had looked at me lovingly, but whom I did not know. More than 10 years later, at my mother's deathbed, she confessed to me that I had been born out of an extramarital relationship, my father being a Jewish man who had been deported and killed during the Second World War. And my mother showed me his picture. The unknown man that I had seen more than 10 years before during my NDE turned out to be my biological father. Some patients can describe how they returned into the body, mostly through the top of the head, after they had come to understand that it wasn't their time yet, or that they still had a task to fulfill. The conscious return into the body is experienced as something very oppressive. They regain consciousness in the body and realize that they are locked up in the damaged body, meaning again all the pain and restriction of their disease. Quote, when I came to in my body, it was dreadful, so dreadful. The experience had been so beautiful that I didn't want to come back. I had wanted to stay there, and yet I came back. From that moment, it was a real struggle to live my life inside my body with all the limitations I experienced at the time. But later I realized that this experience was in fact a blessing. For now I know that the mind and body are separate and that there's life after death. And about all people who have experienced an NDE lose the fear of death. Quote, it is outside my domain to discuss something that only can be proven by death. For me, however, this blessing experience was decisive in convincing me that consciousness lives on beyond the grave. And I know now for sure that body and mind are separated. Death was not death, but another form of life. So we have to come to the surprising conclusion that in our study during cardiac arrest, all these reported elements of an NDE were experienced during a transient functional loss of all functions of the cortex and the brainstem with a flatline EEG. But how do we know that the EEG is flat in those patients with cardiac arrest, and how can we study this? Through many studies with induced cardiac arrest in both human and animal models, cerebral function has been shown to be severely impaired, compromised during cardiac arrest, with complete cessation of cerebral flow, causing the clinical findings of the sudden loss of consciousness, the loss of breathing, apnoea, the loss of all body reflexes, a function of the cortex, and also the loss of all brainstem reflexes, like the gag reflex, the corneal reflex, and fixed and dilated pupils. And the electrical activity in the cerebral cortex, but also in the deeper structures of the brain in animals, has been shown to be absent after 10 to 20 seconds, a flatline EEG. And in an acute myocardial infarction, the duration of cardiac arrest is always longer than 20 seconds. So all 562 survivors of cardiac arrest in the 4 prospective studies must have had a flatline EEG. Now, it's extremely rare that a simultaneous registration of the electrical activity of the heart, the ECG, and of the cortex of the brain, the EEG, during cardiac arrest could be monitored. But such a simultaneous registration of an ECG and EEG is shown here. A patient was referred because of sudden periods of unconsciousness. And during this registration of 60 seconds, each trip is 10 seconds, and spontaneous cardiac arrest assistedly with loss of consciousness occurred. Now, yeah. This is the EEG, this is the ECG, and here an asystole occurs. So the electrical activity of the heart disappears. And after about 10 seconds up here, the EEG changes a lot. And then here, after 18 seconds, the EEG becomes also flatline. So a flatline EEG and a flatline ECG. And of more than 30 seconds of flatline asystole, a ventricular tachycardia occurs with, again, electrical activity of the heart, and the EEG comes back also. The patient received a pacemaker, after which he remained complaint-free. Now, the conclusion about conscious experience during a flatline EEG is often called impossible and unscientific. The quite often proposed objection that the flatline EEG does not rule out any brain activity because it is mainly a registration of the electrical activity of the cerebral cortex misses the mark. The issue is not whether there is any brain activity of any kind whatsoever, but whether there is a measurable brain activity of the specific form regarded by contemporary neuroscience as a necessary condition for conscious experience, with visible activities in many neural centers, the so-called global neural workspace. And it has been proven that there is no such specific brain activity at all during cardiac arrest. So, for me, it was indeed a scientific challenge to discuss new hypotheses that could explain the possibility to have clear and enhanced consciousness during a transient period of a non-functioning brain, with memories, with self-identity, with cognition, with emotion, with the possibility of perception out and above the lifeless body. To explain the reported interconnectedness with the consciousness of other persons in the past and of deceased relatives. To explain the possibility to experience instantaneously and simultaneously non-locality, a review and a preview of someone's life in a dimension without our conventional body-linked concept of time and space, where all past, present, and future events exist, and even to explain the experience of the conscious return into the body. Now, most material scientists still don't believe in the possibility to experience and enhance consciousness during a period of a non-functioning brain. And they try to debunk everything I have said and written by simply stating that obviously an NDE must be produced by the brain. They only change their mind as soon as they have experienced an NDE themselves, like Eben Alexander and many other physicians. So my advice to them is, try this small and dangerous footpath and find out yourself. In my recently released book, Consciousness Beyond Life, which was a bestseller with more than 250,000 copies sold worldwide, I've written that based on prospective studies on NDE, based on recent finding in neurophysiological research, and based on concepts from quantum physics, our consciousness cannot be localized in a certain time nor space. This is called non-local consciousness beyond time and space. So, in this concept, our endless of non-local consciousness with declarative memories finds its origin in and is stored in a non-local realm as wave fields of information. And the brain only serves as a relay station for parts of these wave fields of consciousness to be received into or as our waking consciousness. The function of the brain should be compared with a transceiver or transmitter-receiver or interface, exactly like the function of a computer. Different neuronal networks function as interface for different aspects of our consciousness. And the function of neuronal networks should be regarded as receivers and conveyors, not as retainers of consciousness and memories. And in this concept, non-local consciousness is not rooted in the measurable domain of physics, our manifest world. However, the physical aspects of consciousness, which originates from the wave aspects of our consciousness through collapse of the wave function, objective reduction, can be measured by means of neuroimaging techniques like EEG, fMRI, and PET scan. With this concept of non-local consciousness, all reported elements of an NDE during cardiac arrest could be explained. Now, in trying to understand this concept of interaction between non-local consciousness and the material body, it seems appropriate to compare it with modern worldwide communication. There is a continuous exchange of objective information by means of electromagnetic fields for radio, TV, mobile telephone, or laptop computer. At this very moment, we are invaded by hundreds of thousands of telephone calls and hundreds of radio and TV programs. But we become only aware of these electromagnetic informative fields at the moment we use our mobile telephone or by switching on our radio, TV, or computer. And what we receive is neither inside the instrument nor in the components, but thanks to the receiver, the information from the electromagnetic fields, the cloud, become observable to our senses, and hence perception occurs in our consciousness. Internet with more than 1 billion websites can be received at about the same times in the USA, in Europe, and in Australia, and is obvious not located inside our laptop, nor is it produced by it. Information from internet is always and everywhere available because it is stored in the cloud. This concept can be compared with non-local consciousness. So now we can conclude that our waking consciousness, or ego, which we experience as our daily consciousness, is only a part of our whole, our endless non-local consciousness, which is also can be called universal consciousness, or cosmic consciousness, or divine consciousness. This view of a non-local consciousness allows us to understand a wide variety of special states of consciousness, such as can be experienced during a critical medical situation, an NDE, during an acute situation of apparently unavoidable death in an imminent traffic accident or mountaineering accident, a fear-death experience. This experience can also be reported during meditation or deep relaxation, a mystical, religious, or enlightened experience, during changing states of consciousness during regression therapy, hypnosis, hypnagogia, severe depression, isolation, or the use of drugs like LSD or DMT, ayahuasca. And these experiences of enhanced consciousness may also occur during the terminal phase of life, the deathbed visions or end-of-life experiences. During the end of life, people sometimes report encounters with deceased loved ones who welcome them, the sight of a beautiful, unearthly environment, and a bright light, or a sense of unconditional love. The content of such deathbed visions can bear a striking resemblance to an NDE. Like an NDE, the deathbed vision takes away the fear of death. Unfortunately, many accounts of deathbed visions are either not recognized as such or as interpreted as hallucination, terminal confusion, or as side effects of medication. A shared death experience or empathetic NDE. And this experience is caused by the strong emotion felt upon the death of a dearly loved person. A healthy and empathetic person may share, as it were, in the death experience of another person who is dying or has just died. Then they have the sudden back, and then they are sudden back in the body, and back at the bedside of the deceased relative. They are taken with the dying person. The content of this shared death experience may be identical to a classic near-death experience. The interconnectedness with non-local aspects of consciousness also explains apparitions at the moment of death, like being in contact with non-local aspects of the consciousness of a dying person at a distance, the so-called perimortal experience, where they receive information about the moment of death and even sometimes about how and where they died. This information could not be known at that moment. Mostly these perimortal experiences occur at night during sleep, but these experiences are far more clear than a dream. And the so-called post-mortal experience, or after-death communication, or ADC, is the inner feeling of knowing to be in contact with the consciousness of a deceased person. It is still a big taboo to talk about the sensation of being in contact with a deceased loved one during the weeks, months, or years after his or her death. This contact can consist of sensing a presence, feeling touched, or seeing the deceased person, and is sometimes accompanied by communication, certain fragrances, or unexpected chance incidents that are intuitively linked with the dead person. People can share this experience only when they feel a great deal of trust and know that they will not be at the receiving end of prejudice or negative comments, like it's just wishful thinking or it's just your grief talking. These experiences also mostly occur during sleep, and this is why they usually call it just a dream. Postmortal experiences, or ADC, are still a huge taboo in the Western world, despite the fact that about 125 million people in Europe and more than 100 million people in the USA must have had an ADC. The fact that contact is possible with the consciousness of a deceased relative is usually very comforting and helpful in the period of mourning. And healthcare workers and family members should not call an ADC an hallucination. The result of an ADC is that usually the fear of their own death will disappear as well. The interconnectedness with these informative fields of non-local consciousness also explains enhanced intuition, like clairvoyance, clairaudience, prognostic dreams, and visions, the non-local information exchange. And as I told before, following an NDE, most people, of their own amazement and confusion, may experience such an enhanced intuitive sensitivity, which means having access to non-local information that is not received by our senses or by our body. Presumably, the functional receiving capacity of the body and brain is permanently enhanced following an NDE, which can be compared with a radio receiving not only channel 1, your own personal consciousness, but at the same time channel 2, 3, 4, and 5, the consciousness of others. William James called this a lower personal threshold of consciousness. This remote non-local communication or entanglement seems also to be demonstrated in remote viewing, non-local perception, and in the effect of consciousness on matter, like in non-local perturbation, as in neuroplasticity, where EEG, fMRI, and PET scan studies, functional and structural changes in the brain are demonstrated following changes in consciousness, like in meditation, mindfulness training, or placebo treatment in patients with depression, chronic pain, or with Parkinson's disease, which obviously leaves us only one conclusion. It is mind over matter. Since the publication of several prospective studies on NDE in survivors of cardiac arrest, with strikingly similar results and conclusions, the phenomenon of NDE can no longer be scientifically ignored. It is an authentic experience which cannot be simply reduced to imagination, fear of death, hallucination, psychosis, the use of drugs, or oxygen deficiency. And people appear to be permanently changed by an NDE during a cardiac arrest of only some minutes' duration. According to these studies, the current materialistic view of the relationship between the brain and consciousness held by most physicians, philosophers, and psychologists is too restricted for a proper understanding of this phenomenon. Materialistic science starts principally from a reality that is only based in physical, observable data. But we should be aware that beside external and so-called objective perception and observation, there are also subjective, not observable and not demonstrable aspects like thoughts, feelings, inspiration, and intuition. We can only measure the electrical, magnetic, or chemical activities in the brain by EEG, MEG, or PET scan, and we can measure changes in blood flow in the brain by fMRI. But these are only neural correlates of consciousness. These measurements do not explain anything about the production nor about the content of consciousness. With our currently available scientific and objective techniques, one is not able to even prove, measure, nor objectify the content of the subjective experiences in our consciousness. Direct proof about how neurons or neuronal networks could possibly produce the subjective essence of our thoughts and feelings is totally missing. By making a scientific case for consciousness as a non-local and this ubiquitous phenomenon, this view can contribute to new ideas about the relationship between consciousness and the brain. Research on NDE questions the purely materialistic paradigm in science. And so it seems to be important for scientific ideas about the mind-brain and mind-body relationship. But it is also evident that it is important for our concepts of life and death, because of the almost unavoidable conclusion that at the time of physical death, consciousness will continue to be experienced in another dimension in which all past, present, and future is enclosed. Quote, "Death is only the end of our physical aspects." I believe now that death, like birth, may be a mere passing from one state of consciousness into another. However, we should acknowledge that research on NDE cannot give us the irrefutable scientific proof of this conclusion, because people with an NDE did not quite die, but they were all very close to death and without a functioning brain. So it has indeed been scientifically proven that during an NDE, enhanced consciousness was experienced independently of a functioning brain. Quoting from a recent death announcement, "All what you have falls into decay, but what you are lives on beyond time and space." So we have a body and we are conscious. Without a body, we still can have conscious experiences. We still are conscious beings. Recently, someone with an NDE wrote to me, "I can live without my body but apparently my body cannot live without me. Based on scientific research on NDE, one cannot avoid the conclusion that endless consciousness has and always will exist independently from the body. There's no body, there's no beginning, nor will there ever be an end to our consciousness. Our enhanced consciousness resides not in our brain and is not limited to our brain because our consciousness is non-local. And our brain has a facilitating function and not a producing function to experience consciousness. Obviously, more knowledge about the results of NDE research and about the possible continuity of consciousness after death could have a significant impact on the practice of medicine, because it informs ideas about the treatment of patients in coma or in the final stages of terminal illness. It could also obviously result in difference in medical practice regarding procedures such as initiating or ending life-prolonging treatment, euthanasia, or the removal of organs for transplantation from somebody in the dying process with a beating heart in a warm body but with a diagnosis of brain death. But NDE research is not only of great practical significance to healthcare practitioners, but also to dying patients and their families. They all ought to be aware of the extraordinary conscious experience that may occur during a period of clinical death or coma, around the deathbed and the dying, or even after death, the after-death communication. To provide NDEers with better help and support than they currently receive, all healthcare workers and family members ought to reconsider the possibility of an NDE after a patient suffers from a life-threatening crisis like cardiac arrest or coma. In the event of an NDE, the doctor or therapist should not reject the experience as a pathological or anomalous incident, but regard it as an existential and life-changing spiritual crisis with all the disorientation and psychological problems such a crisis entails. In the past, a lot has been written about life and death and also about special states of enhanced or non-local consciousness. But surprisingly, many people nowadays still have never heard about near-death experiences. And this is why they still believe that death is the end of our existence and the end of our consciousness. People are afraid that with death, everything comes to an end. And as a young doctor, this was also my idea about death. I was raised in an academic world where I was taught that for every observation, a reductionist and materialist, a so-called scientific explanation was obvious, which made it impossible to accept that a clear consciousness could be experienced during a period of cardiac arrest or coma, or even briefly before, during, or after death. But today, science for me means asking questions with an open mind. Science should be the search for explaining new mysteries rather than to stick with old concepts. And he who has never changed his mind because he could not accept new concepts has rarely learned something. I can assure you that I learned quite a lot because of all those patients who were willing to share their NDE with me, and they have greatly changed my views of the meaning of life and death. People with NDE have been my greatest teachers. My current view is now, as I have already stated before, there are good reasons to assume that our consciousness does not always coincide with the functioning of our brain, and hence consciousness can sometimes be experienced separately from the body. And I am aware that this concept can be little more than a stimulus for further study and debate. And above all, we should question the purely materialist paradigm in science. Remarkably, in a recent representative social poll in Europe, about 55% of the population, more than 250 million people, believed in some kind of personal survival. And in the USA, this percentage is even higher. These surprising high figures are a sharp contrast with the opinion of the majority of Western scientists, who systematically ignore and ridicule the possibility of personal survival after physical death. We desperately need a real paradigm shift in science. I believe and hope that in the near future, modern science will include empirical research on unusual subjective experiences that may occur in our consciousness, and that we will accept non-local concepts to understand how we are interconnected with each other and with our endangered planet. I realize now that everything originates from consciousness. I now understand that people create their own subjective reality based on their consciousness and create the intention one lives his life. We should recognize that our view of the world is wrong, because we do not realize that the world as we see it only derives its subjective reality from our consciousness. Because it is only our consciousness that is determining how we perceive this world. If we are in love, the world around us is beautiful. When we are depressed, our world is like hell. When we are frightened, made terrified by politicians and by the press, our world will be full of terror. The mind in its own place and in itself can make a heaven or hell, wrote John Milton even in 1667 in his poem Paradise Lost. Regarding what we can learn from people who are willing to share the NDE and ADC with others, I would like to quote Dag Hammarskjöld. Our ideas about death define how we live our life. Because as long as we believe that death is the end of everything we are, we will give our energy toward the temporary and material aspects of our life. In our short-sightedness and sometimes willful ignorance, we forget to reflect on the future of our planet, where our children and our grandchildren will have to live and survive. We forget about the sustainability, as we are now destroying and exhausting systematically our planet, just because we are living in a competitive and materialistic society. We should stop thinking and acting as if we are better than others, because this will always be at the expense of children and other weak and delicate creatures around the world. We should realize that the harm we cause to each other and to nature ultimately is harming ourselves, because we as humans are not only intensely interconnected and tangled with each other, but also with animals and plants living on our endangered planet. I hope that in the near future we will accept non-local concepts to understand how we are and always will be interconnected with each other, also after physical death, that we have to change our personal consciousness, not only to change the way we live, but also to change the way we want to treat, honor, and respect people who are willing and able to share their NDE and ADC with us. Their lives changed in ways they were not prepared for. They all tell us that they fundamentally changed their ideas about life and death because, quote, you can be physically dead, but your mind lives on. Another quote, death was not death, but another form of life. Consciousness seems to be our essence. Once we leave our body, leave our physical world, we exist as pure consciousness, beyond time and space. We are unfolded in pure, unconditional love. As a woman with Andy wrote to me, when the power of love becomes stronger than our love for power, our world will change. It will require a huge change in consciousness indeed. We should all feel the responsibility for this change. Thank you for your attention.
We will now have a Q&A session. The microphone is back towards the center aisle. Please approach the microphone, ask your question of Dr. van Lommel, and he will respond. Thank you.
First, I have a question to you before I receive questions. Who of you knows a person who had an NDE? Thank you. Who of you had an NDE yourself? Thank you. Who of you have ever had the feeling of knowing, inner knowing, to be in contact with the consciousness of deceased relatives? I will say, look around you. You see how normal these experiences are. Thank you. You got a question?
Dr. Van Lommel, thank you very much. Great presentation. A question that has always plagued myself as a physician during end-of-life decisions and brain death. With the knowledge of continued consciousness, despite the dead brain, as science defines as death, how should we, as doctors, how should we approach that subject and transplantation, like you well put, and things like that?
Thank you for your question. I always hope to have this question. When the first heart transplant was done in 1967, there became the problem how we get organs for transplantation. Now in 1968, the ad hoc committee in Harvard with ethical people and surgeons said, when we take a long-term coma, they call it coma dépassé, we call this brain death, and then we call brain death death, then we have organs from dead people. So it was a constructed definition of death. Now, what is exactly brain death? In most countries, the definition is different. Like in UK, it's brain stem death. And when the diagnosis of brain death is well done, which is sometimes very difficult, that means that 3% of the body is irreversible damaged, 97% of the body is alive and is kept alive, because you need to transplant living organs. Now the law says in the Netherlands and also here in the US that brain death is death. That means that they talk about the artificial respiration of a corpse. Everybody knows this is impossible. And there are more than 10 women who have been declared brain dead because of a rupture of the aneurysm of the cerebral artery. And they were kept on artificial respiration and medication for weeks until they gave birth to a living child. A corpse cannot give birth to a living child. In many countries, like in Switzerland, anesthesia is given to this corpse because there are so many reflexes still there when they try to open the body. I even know a story that when a surgeon came in the operation room, this corpse turned his back to the surgeon and they stopped the procedure because everybody was so afraid. So brain death means the process of dying. When you take out a living organs like the heart and lungs and other things, you will die. You will enhance the process of dying extremely. So it's not a normal process of dying anymore. And I don't know exactly what will happen to consciousness of the person who is dying. Also, when the body and brain are seen as receptors for consciousness, then also organs, living organs, are still receptors of parts of consciousness. When you transplant a liver or a heart or lungs into another person, living organs, then these organs are still receptors of the consciousness of the deceased donor. And we have stories about it, that people change their personality and feelings because of the organ they got. In the United States, it's possible to, after 4 years, to know the person who was the donor. In Europe, it's hardly possible to know who was the donor. And transplant centers are very reluctant to give any study to do on these changes as well. We tried to do it in Europe, but transplant centers didn't want to cooperate with us. So brain death is not death. When you take out organs from a dying person, you enhance the process of dying. And I don't know exactly how it is in the United States, but in Holland, Germany, and most European Union, it's a very limited explanation to the general population of what it's all about. They just talk about people dying on the waiting list, but they don't talk anything. They don't say anything about the donor and the family of the donor. I'm not against organ donation, transplantation, but people should know what they decide for. And mostly they do not know at all. And that is why when doctors come to family and say, well, your son or daughter or husband or wife is dead, can we take the organs? And you come to this body, you see a living body with all normal functions, a living body, then they know intuitively that this is not death. And they mostly refuse the organ donation because they know this is not death at all. So it's a big problem. And I think the government and the transplantation organization should be more open about what is really going on during transplantation. Thank you for your question.
Dr. van Lommel, thank you so much for a superb talk. I really appreciate it. I have a question to you personally, so I'm not expecting you to answer this for all scientists. I attended, well, I was present about 7 hours after my second mother passed away in a hospital, and I was able to assist a nurse just in cleaning the body and getting it ready to go. And she was completely cold, except around her heart area. It was warm as...
But her heart.
Or as I am warm right now, around especially around her chest. And it was alarming to me. I asked the nurse about it. The nurse said, just let it go completely. So my question to you is, what do you personally feel is appropriate in terms of allowing the body to rest prior to any of the functions that we usually do, cremation or embalming in some way, or putting it in a refrigerator, et cetera? So I was curious how you look at that.
I think in most cultures, especially the Christian culture, we say, leave the body at rest for 3 days. And I think it's just kind of inner knowing that we do it. About the warm feeling about the heart rate, it's because there's still, at this moment, a kind of connection. The latest Karmapa, who died in a Buddhist, high Buddhist monk, who died in the United States, had for 10 days a warm area around his heart. And his body was still not decomposing at all. So he still had a contact with his dead body as well. So I think we will have to give the body rest for 3 days, that every energy, information, and life energy has gone out.
Thank you so much.
I'd like to ask 2 questions. The first one is, what gave you the courage to come out and publicize your work and expose yourself somehow to the ridicule of the scientific
I don't think it's about courage. It's about being honest to yourself and to others. If you have the inner feeling that you have to do it, you do it, independently of other people think about it. So, when people have problems with what I tell them, then they have a problem, and not me. I think that is what I've learned. I give lectures at universities. I was in New York for the New York Academy of Science of Yale University, but also a lot of universities in Europe as well. And I know that there are people who are reluctant to be open for it. But mostly those people who are very reluctant don't come to my lectures. And they have an opinion not based on knowledge, not based on facts. They're just full of prejudice. And they are afraid. They're frightened. Because if it would be true what I tell, their whole worldview will collapse. So they are frightened and fear, and that gives rise to a lot of aggression as well, always towards the messenger as well. So, but it's not about courage. I don't feel courageous.
Well, the second question is, if you have any suggestions on how to change this paradigm once we realize that there are hundreds of well-designed scientific publications pointing towards no local mind and no local consciousness, when you even compare to the simple, poorly designed studies that overwhelmingly put aspirin and statins as preventive of cardiovascular disease, and now the pharma companies make billions of dollars with those drugs.
Well, the problem is that there have been many studies done, but also there's a lot of criticism about the studies that has been done, not only, but in the, let's say, in the official medical science. A lot of has been paid by the health profit industry as well. And studies done about the non-local interconnectedness or non-local healing, whatever, are still hardly known in the medical community, because most editors and head editors of journals, medical journals, don't want to put it into their journals because they don't think it's real science. So it's an enormous gap between what we know and what has been written down, what people in the medical and scientific community can read. It's a censorship by scientists.
Thank you.
Thank you very much, Dr. van Lommel. If anyone has any other questions, you may be able to catch them during lunch. Now it is our lunch hour, and we ask that you return by 1:10 to be ready for the next session. Thank you very much.